The information, comments, and opinions expressed in this presentation are those of the speaker based on their own clinical experience and interpretation of the literature and for educational purposes only. Practitioners should evaluate the information, comments, and opinions using their own expertise, coupled with an assessment for each patient. The information in this presentation is neither approved nor endorsed by NUMEDICA. The content herein does not necessarily represent the views or brand of NUMEDICA formulas. None of the content herein has been evaluated by the Food and Drug Administration. NUMEDICA formulas are not intended to diagnose, treat, cure, or prevent any disease.
All right. Welcome, everybody. It's nice to see that those of you that joined us. First thing I would like to do is make a heartfelt apology. I don't know if you saw my social media post on this or not, but we had some technical glitches that happened last week when we were trying to fire up the webinar. And there is a great irony involved because we're sitting there about to do a webinar on stress and adrenals and how cortisol levels happen and how you decrease your stress levels. And we couldn't get the technology to work to save our lives. There was some kind of a spam filter thing that went on, the details of which are a little bit beyond my ken, but suffice it to say, it was, you can thank the imps in the internet for raising too many security issues, and as a consequence, we weren't able to get it started. So my apologies for those of you that were looking forward to that last week. I hope that you're either joining us this week or you're watching this on recording later on to hopefully answer some of those questions. But again, I can date myself by saying I'm old enough to remember when we used to say that technology was a labor-saving device, because nobody says that anymore. So, having had our own little exercise in stress inducement last week, we're going to talk about how to deal with that stress this evening. So I would like to thank you for joining us for the NUMEDICA Grand Round series. This is going to be a little bit more interactive than the usual. And joining us this evening is an expert on stress and how to manage it, Dr. Larry Ward of Tulsa, Oklahoma. Larry is a DABC who's been a prestigious member of our community for more than a few years, and a very dear friend of mine. I had him on our radio shows here out of Austin for on several subjects, and I know that over the years he's been working on trying to consolidate his learning into a tome that is useful and readable by everybody. And sure enough, I was one of the early beneficiaries of a copy. If you have not seen it, okay, Cortisol Nation by Dr. Larry Ward. And so to talk a little bit about the book and ways that you can address the various forms of cortisol dysregulation and what that looks like in your practice, let me introduce my dear friend and esteemed mentor, Dr. Larry Ward.
Hello, hello. First off, let me clear up the misnomer. I am not a DABC. I've gone through 300 hours. I've taken all the classes, but I did not sit the test. So the test is a daily progressive test, and I just want to put that out there because I have highest respect for those that did test and didn't have the maladies in their life that created me from testing, like a divorce and a death and
all
so,
those things that drive cortisol forward.
All those things that drive cortisol. That's why I'm an expert.
So tell us a little bit about cortisol. Why did you choose that?
Because, well, for my own health issues, 30 years ago, I got into the field of health related stuff because of my own cortisol issues. I didn't know I had cortisol issues. I thought I had time issues. I only worked 3 jobs at a time, and there just wasn't a time to work 4, and I couldn't figure out how to make that happen. And I kept having these issues when I got out of the Navy, and they kept putting me on prednisone. And at one point, I was up to 9 prednisone a day. I was bartending at night and working during the day and throwing pizzas in the afternoon, and I was wired beyond belief. Friend of mine, I'd been to every VA doc at the time. Friend of mine said, go see this nutritionist guy. He's got a little health food store down on Admiral. So I did, and he read my record. He said, you got this and this and this going on. I said, yeah. He said, if you'll do these things, then you're going to have changes in your life that are going to be good. Well, I didn't know anything better than what normal people do. You have a problem, you take a pill. You have an issue, you go to the doctor. You turn your will and your life over to the care of your doc. And that's what I had done, and I got nowhere. This guy made sense. I decided to try the top 3 or 4 things. I did. I was so impressed. I ended up working for him in that health food store about 30, 40 days later, stocking herbs in the back room. And that's what led me to learn about and know what I've come to today. Cortisol itself has got a bad rap. Cortisol it is exactly what it's supposed to be. It's an immune booster. It operates to keep us out of the mouth of the lion. It operates to give us the strength that we need when we're overcoming difficulties. But the problem is our lifestyle has got that so imbalanced that we see patients today. We have our own deals of stress when they're coming in the door, and they're coming in the door with their own set of stress. We get to testing for thyroid, we get to testing for adrenals, we get to testing for the things that seem to be the drivers, but behind the scene of all that is cortisol. So when we looked at that hypothalamus and its creation of what it should be creating to help support and give our body our thyroid TSH and continue on throughout what we are putting it through, we get abnormal reactions because we're constantly in that high stress sympathetic nervous system tone. You and I both know we're not supposed to be in that tone. We're supposed to be in the rest and repose, parasympathetic, but our body never gets a chance to rest.
Well, I went to TCC, so I think I left that whole rest and repose thing the minute I got my degree. But and it's funny you should bring it up because social media, there's one guy out there in particular, and every time I see, another little video snippet by him, I mean, you paint cortisol like the issue across the board for everybody you see is that everybody's got screamingly high cortisol levels, and it always needs to be suppressed across the board. And like it's this blanket statement like this is the big boogeyman and everybody needs to have it suppressed. But having listened to you talk on this subject before, that's not really the case. You can't just kind of put everybody in the single, basket and it's headed toward the smoky place, right? So if it's not all in the same handbasket, what are we dealing with?
Well, first off, to test for cortisol, you need to be able to test the rhythm of cortisol, and that's called the diurnal rhythm, and it should be high in the morning and low at night. But if I'm doing a blood test for cortisol, I'm getting a snapshot right then. I'm not getting the overall levels of what's going on in that system. So I do a salivary test and get the best results as far as I have known over these years. The salivary test is a 4-point test. We're testing in the morning, midday, afternoon, and nighttime. So we're getting that rhythm to know exactly how the body is reacting and how it should. It should be peaking high in the morning and low in the evening.
So I got two distinct questions about that because I'm a big data-driven guy. And so my first two questions are about methodology and then the snapshot. So if I've got a single salivary point in the morning and it's either elevated or it's depressed, can I infer anything off of that single snapshot to tell me what it's doing during the course? Or is that just, I mean, is there no real prognostication about what the morning will do by the time you get to the afternoon?
Well, you can if that's your spouse or your brother or your sister or your coworker that you have spent the previous 12 or 14 hours with, and you know what their normalcy is. Otherwise, somebody's high cortisol in the morning could still be flatlined, or it could be high when it's not supposed to be later in the day, or it could be low in the morning and high at night. And we call that a reversed curve. So we look for the differences in 4 different categories.
What are the four categories? Because I know you talked about them in your book.
We talk about the wired type. That's the tired and wired. It's a sympathetic nervous system on crack. Cortisol stuck high. Here we go. I got to do. The body never gets the rest. Our ancestors running from a bear or running from a saber-toothed tiger, for example, they at least had a downtime after that hunting or gathering portion. Um, in the book, I talk about our bodies were built for 1925, not 2025, because back in 1925, our grandparents or great grandparents They got up in the morning, they worked hard through the day, they had lunch, they had dinner, they sat around the table. So they had the sociability, they had the emotional support, they had the downtime to allow the body to downregulate to the normalcy that it should be in the evenings. We, in today's society, we don't get that chance. The wired and tired portion is the most common, but in that same sense, we've got flatlined. Flatlined is where there's no peaks and valleys. They're exhausted in the morning, they're fatigued through the day, they get to crawl in bed at night and can't sleep, or they sleep 14 hours. You have the reverse type, and that's the ones that can't get out of bed in the morning and can't go to bed at night because their cortisol is completely flipped backwards. We think about wired, tired, flatlined, and reversed. That brain under cortisol is just sizzling. So we've got to come to a balance.
I know that a lot of people where that snapshot is concerned, there's been some discussion, and I've seen it work both ways, where you're comparing the ratio of total cortisol to DHEA, and that ratio will give you some not as accurate as a 4-point cortisol curve by salivary, but at least it'll give you a snapshot of like how far along that curve they're going. Have you seen that cortisol to DHEA ratio play out, or do you think that that's you still are best served by doing the salivary instead?
Honestly, I don't use the ratio. I do the salivary because I want a distinct understanding of the pattern of what they're going through. That ratio will give me a facsimile, but I can find out from them answering the quiz that I have on my website or the quiz in the front of the book with their symptomatology. I can get a better read on that than I can actually that ratio.
So tell me a little bit more about the quizzes, because when you gave this beautiful lecture that I attended in about 4 hours worth in Arkansas, and you went in some small detail about the questionnaire, and it's not just like a 10 question; it's a small novel by itself, where you break down the various types and gives the rankings, and this fun part is you handed this survey out. I want to point this, everybody is like on this webinar. Can you imagine sitting in a room with this? You've been sitting there, all weekend listening, and you get this questionnaire, about how your adrenals are doing, and you're like tripping off, and across the room, you're, oh no, just like, physician heal thyself. I'm like, we're all going into the
Okay.
back to get the L-theanine. So tell me a little bit about the questionnaire, because it's actually detailed enough. You can use it just by itself for symptomatic diagnostics.
Indeed. And you mentioned one of the cornerstones of what we use, L-theanine, thankfully.
There we go.
Uh, I have in my book, I talk about several different patients over the years. One in particular comes to mind when you're talking is she was so wired. She was on the beach on a vacation and called me. While she's on the beach, she's having a complete meltdown. And I asked her, I said, "Do you have theanine in your purse like I told you to have?" "Yes." I said, "Take it out and swig it. Don't bother doing a dropper full. Swig it. Call me back in 3 or 4 minutes." And she did, and that immediately helped support her as she needed. When we think about that sense of being so wired, it, the whole point of the prefrontal cortex, the whole point of the hypothalamus, the whole point of the amygdala, they get so imbalanced that you can't cognitively come up with the thoughts. You can't spit them out. They're going so fast through your mind. You can't put down what it is that you're trying to control because your impulse control is out of whack. Your prefrontal cortex is not giving the correct information. The amygdala, your alarm center, is screaming, alarm, alarm, rather than giving you healthy responses. And your hypothalamus of the reasoning center of being able to think clearly is fogged. So all of the fatigue, brain fog, lethargy type stuff can be diagnosed, as you know, several different ways. But I always look behind the scene to see where the cortisol is, that's the driving factor for those things.
So I got a couple of questions because you're saying things that are tripping off in people's heads. Let me ask in kind of a slightly off order. So Dr. Bennett asks, do you know if there's some variation in how well L-theanine is going to work based on certain genetic SNPs? Is there variations in terms of how people are going to react to that?
Good question. I think you're far more expertise to answer that than I, but from a clinical standpoint, I have yet to see, I have ever, I've never not seen anybody react positively to L-theanine. To the extent of that, some people just take a drop or two in the evening to help them sleep. Some people take a dropper full 3 times a day. I tell my patients that are having anxiety and anxiousness to do 2 droppers full 3 times a day minimum and carry it with them and use it PRN as they need along the way. As far as genetics, you tell me, Victor, do you know of any
Well,
genetic response issue?
well, no, not for, well, so theanine works as a potentiator for the GABA receptor. It potentiates a lower threshold response.
Right.
So I mean, variations in GABA receptors will tell you how strongly it's going to react, but they're all going to work through allosteric mediation. The other thing I will say is it actually seems to have a stronger influence. And Dr. Bennett, if you wander over to my website, I wrote a couple of blog posts on this. It's the same lecture part of the same lecture I was giving with you, Larry, with that we were talking about the interaction of the CBS to cis-thione beta synthase, because when there's several permutations on that when it goes down, you get these spikes in glutamate. And neurocognitively, there's this weird bleed over because you'll see cortisol levels go bonkers trying to compensate for elevated glutamate as a neuroexcitatory agent. And that's where those people in particular, the L-theanine seems to help because it kind of gets in and by interfering with the glutamate, it kind of helps the cortisol out a little bit better. So I'm with you. I've never seen anybody that didn't react to it. I saw people that react stronger or less, depending upon what their
Right.
neurochemistry looks like. The problem is
Right.
that glutamate's just so hard to measure because there's not a lot of labs that do it. By the way, if anybody's worried about L-theanine, I'll tell the story. And Larry was like, I mean, I could see somebody like just take a big old swig. It's like, stick an umbrella. She's on the beach, stick an umbrella in it, like swig it back. But so NUMEDICA had just come out with their liquid L-theanine, and they sent me like 2 or 3 bottles to play with. And I took one home, and my kid was like 3 years old at that point, and I was like, it was thunderstorm outside, so I gave a dropper to the dog, and the dog kind of calmed down, and like, oh, that's kind of cool. And my kid was owly at that night because he's 3 years old at that point, and I gave him a dropper full, and he's kind of like calmed down nicely and went to bed. I'm like, that's pretty cool. So I woke up the next morning on Saturday, and there's this little blonde head beside my bed going like, Daddy, I took all my medicine. And I look over and like blearily look over, and there he is. There's the empty bottle. He had liked the taste of it, so he crawled up to the top and opened the medicine cabinet and glugged it all down. And I'm like, and my wife's flipping out about he's gonna die, and I'm like staring at him and listening to his chest. I'm like, okay, you feeling okay? Yep, doing fine. Go play. So he calmed down and like went and played in the corner very nicely. And I'm like, I I may need to repeat this for science. So I texted my NUMEDICA rep and went, hey, by the way, my kid just drank an entire bottle. You literally could hear the sphincter slam shut on the other end of the text string. And she was like, and so she so she tells everybody at NUMEDICA, and apparently that became a thing. And the next week I'm driving to give a lecture in Dallas, and I get this, my wife gives me a call. We just got a package through NUMEDICA. I'm like, what? She says, it's gift wrapped. Okay, open it up. It's 3 bottles of L-theanine. I'm like, okay. So they took me seriously about repeating the experiment. Anyway, so if you're docs, the upshot of that is if you listen to Larry's story about like basically swigging the entire bottle, don't worry. The LD50 for L-theanine is 5 grams per kilogram of body weight. So you could drink a gallon of it and still be just fine. I will also tell you it works fine on anything with fur because I've used it on dogs and cats and pigs, and I'll tell you about the happy bacon story later. Anyway, so that's one intervention. Dr. Warwick, and forgive me if I mispronounce anybody's names through this. And thank you, by the way, those of you that are sending in your questions. I've got the Q&A is great there. I'll be happy to pass them along. Dr. Warwick is asking if you're going to be sending the adrenal questionnaire out to the attendees tonight. I know that you've got it as a file somewhere. I'm going to let you decide whether or not we're going to send that out. But I will say that if you want, I know you've got it. We'll see if we can send it out, but it is also in your book. So if you got a copy of Cortisol Nation that's available through the NUMEDICA site, you got a copy of that plus all the good science behind it. Um, so let's see if we can manage to figure out how to get people a copy of the questionnaire at least that maybe you send out. But to get the details of how to treat them, you're actually going to have to buy the book. Uh, is that fair? Um,
I
I got
think
to
we
admit,
could.
it was fun watching because, like I said, as everybody was taking this, we had this progression as we were seeing just how bad our numbers were. Because all of us had thought we were doing well. It's like, no, I'm not doing well there. Give me some of the highlights of the questionnaire for Dr. Warwick. I mean, what are the big red bells that were red alarms we're looking for on this questionnaire?
Well, we're trying to separate out which category is most effective because if I'm treating a tired type in a wired presentation, I'm driving it down. I'm not helping. I need to build up with something like ashwagandha on a tired type. I need to chill down a wired type with something like theanine. The questions themselves give us the ability to differentiate between those types that we're then able to determine how best to support the imbalance.
So, while we're trying to figure that out, I know like when you move on in your book, you've got a couple of but because you mentioned ashwagandha and certain herbals, but before we get into that, we are predominantly lifestyle driven physicians. And I know that a lot of your things are like you got like an emergency reset and some lifestyle interventions that are pretty much useful across the board to try to help out with adrenals. So let's say we got that patient that comes in, we'll call her, Jane Doe, and Jane Doe comes in and she's obviously having some adrenal issues. Um, and I'm going to ask you some other like comorbidities, but she's got some obvious adrenal issues going on and maybe some difficulty sleeping, stress responses, maybe elevated blood pressure and blood sugar, because I know that there's that cortisol insulin relationship that's always kind of nagging in the background. We do, as good clinicians, we run our 4-point cortisol test and a couple of other labs. What other labs do you think are essential if you're running like blood work along with that for them to send in this initial diagnostic?
Well, I'm looking as you mentioned blood sugar. I'm looking at a hemoglobin A1C. I don't want the snapshot of glucose. I want to see how the body is reacting over weeks. So I want a hemoglobin A1C. I want a SED rate. I want to see the ESR for inflammatory, and I do not only a SED rate, but I do high sensitivity CRP because I want to differentiate between that inflammatory response. In a lot of cases, I'm doing a GGT in addition to the metabolic panel giving me AST and ALT. I want to see a GGT to see how much of that is actually coming from the liver as an issue. I'm looking at vitamin D because the aspects of vitamin D can uh, can disallow that cortisol to be as it should. I'm looking at, of course, a CBC and a CMP to see exactly what their health status is.
What do you
What
think about pregnenolone?
well, let me think a minute. I had a patient, um, I guess about 2 months ago, that I tried pregnenolone and I gave her pregnenolone as a supplement. It actually caused, she was having more symptomatic issues than she was before, as far as cortisol was within that realm. And I thought maybe the pregnenolone, I should have also done checked estrogen, estradiol, estrone, estriol, because she just didn't react as I suspected she would have with the pregnenolone as a supplement.
So you think a full hormone panel on top of the hormone cortisol curve will give you a better idea of how that flow through steroidogenesis is going?
Well, it would. I don't go to that as my go-to simply because of cost. I want my patient to be able to have the best response as quickly as possible
Okay.
without a great deal of money. So many times I do go ahead and do the full panel just to see, or I'll do the full panel later on because as we clear away some of the cortisol issues, their thyroid's coming back to a balance. They're having more problems that weren't really showing up before because we're getting a true picture of what's going on in their metabolism. The
So
ER, go ahead.
no. So I was going to ask. So we're sending off the blood work and the 4-point cortisol curve. Maybe we're including a little fuller vision of hormones. We're looking at their blood sugar, liver function, vitamin D, which I think is, again, vitamin D is kind of leads into that off of cholesterol, leads into the whole steroidogenic pathway.
Right.
But while we're waiting, because then there's that gap that as diagnosticians, we're waiting for the results to come back and don't want the patient to suffer. Before we start talking about supplementation, we already talked about L-theanine. What lifestyle interventions seem to work well? Because you went into a lot of detail on this in the lectures.
Well, I call that the emergency reset protocol. We have basic 8 different basics changes that if they're not doing, they should do, and if they do that in the 24-hour period when they first start, I actually in the book say if you test and this is your numbers, go to this immediately and do that the first 24 hours to get the results, and then read throughout the book to get better support. But the whole point in the emergency reset protocol is to do what we call a physiological sigh. The physiological sigh is a breathing technique that they have come up with to realize that physiological sigh, when we're crying, when we're trying to catch our breath or we're startled, we do that little at the top of our breath, and that's called a physiological sigh, and that's actually a way to immediately bring down levels of understanding that physiologically put us back in parasympathetic. I talk about cold water immersion. People go, what? And sticking your face in cold water for 15 or so seconds will immediately stop that sympathetic nervous system, that cortisol spike that's going on. I
That's
talk
that
about a
mammalian
gargle.
diving response, right?
Exactly.
Oh, yeah.
Talk about a gargle, a vigorous gargle. People don't understand, but the stimulus of that vagus nerve is stopping that cortisol sympathetic nervous system response. It's putting us into a parasympathetic mode. You can gargle vodka if you need to, but preferably something like water would be good. If you can stand gargling Coke, I guess that would be okay. But it's that point of gargling that stimulates that vagus nerve.
But
Uh,
apparently don't do it in an airport bathroom, apparently.
no, not a good idea. Um,
You t Sorry,
the
story. Yeah.
emergency reset protocol, we talk about a 20-minute walk. And of any of all the things that we talk about, it's that 20-minute walk that can be the most um, cortisol stimulating, cortisol circulating metabolism aspect. And that's walking without your phone. Walking, and that's a toughie, but that movement of balance back and forth stimulates that parasympathetic tone. I know that's
Tell
what
no,
it's all
tell me
about.
tell me a little bit about the phone. Tell me a little bit about the phone because this is a big thing for me.
The average person, now this is average. I'm far beyond that, and I think you probably are as well. The average person gets 120 texts a day. We don't, no way. We don't do that. But yeah, we're checking our phone at 100. I shouldn't say 120 texts. I say we're checking our phone at least 120 times a day. And what are we looking for when we're looking at that phone? We're looking to see what time is it. Ding, my phone just dinged. Who's rattling my cage? Speaking of ding, no, I've got to put my phone away. Uh, all of those things. I
Physician,
call
heal
that.
thyself, Larry.
I know. That's a cortisol pump, and that's why, because all the figures that I researched and that are in the book in 2012, everything changed. We used to call it the 100th monkey syndrome, if you remember that. The monkeys on one island started acting like monkeys on the other island. They had no interaction between, but yet there's that etherical response stuff that somehow they picked up doing the same actions as what these monkeys were doing. That 2012 point was the point when over 50% of the public had smartphones. So,
Well, you said the big inflection point was January 9th, 2007. See, I read the book. You said because on January 9th, 2007, Steve Jobs introduced the iPhone.
yeah,
And that's
that
where
was,
a lot of your graphs start ticking up.
yeah, that's
Yeah.
true. But at 2012 was when that peak of that initial response of him coming on was. Can you remember watching the news, and the lines are wrapped around the corners, coming out with the next iPhone? They're standing in line to buy the newest, greatest iPhone. All of those things have brought us to the point that the driver of that phone is one of the factors of creating such an imbalance.
Is there a relationship between the cortisol dysregulation and the constant dopamine stimulation?
Absolutely. Absolutely. How many books are written on that? If we if we're constantly trying to grasp at not feeling the way we're feeling, we're looking for that dopamine receptor stimulus. Um, so many, I mean, in the book, I talk about the Surgeon General's report in 2023, and a lot of people haven't even recognized that yet. That was a report he wrote as he writes as a Surgeon General. I shouldn't say he. Forgive me for not being politically correct, because I think the current Surgeon General is a woman. But the Surgeon General's report came out in 2023 that the epidemic of loneliness was the factor that was affecting our general public more than anything. If that's the case, how can that be when at our fingertips is the ability to contact the world? Well, maybe it has something to do with the aspect of our what you shook your finger.
No, no. So it's interesting you bring that up. Tell me about Pennsylvania. Because
Well,
you brought up an interesting story about Rosetto, Pennsylvania.
there was a study done in Rosetto, Pennsylvania, of how the core relationships made such a difference in those people's lives. Their physiology was different. Now it's been since that came out. It's been disputed. It's been accolades. It's been back and forth. But that study showed that our interactions and the core of our relationships has as much an effect as anything else on our physiological function. They were not having as many heart attacks. They were not having as many problem drivers that our normal, when we say our normal public has, they as a core did not have those issues. And they found that it was an Italian community primarily, that they had such cohesion that it affected the system, our physiological function more than anything else.
So, and this is going to be kind of weird for us though, because I mean, normally, particularly as more functional internist sort of approach, um, so much of what we do is strictly biochemistry. You look at the numbers, you look at the symptoms, you give them a pill. When we start bleeding over into the lifestyle interventions, but it sounds, it becomes a little bit more out of our bailiwick where you talk about what's your social life like, what's your community like, what's your overall stress level, how often do you spend on your phone? Those lifestyle interventions kind of feel weird, at least to me, when I start talking about them. And yet, according to the stuff in your book, it sounds like we're not going to be able to address problems with cortisol and adrenal dysregulation unless we actually start dealing with the lifestyle factors that are leading toward the lack of stress, the loneliness, the social isolation that's driving a lot of that forward.
Without question. Now, we may not feel comfortable asking, getting into somebody's business. Long pause, because why? Um, it's I, I hug my patients. I pray with my patients. I want to know how they're doing. It's not just wham bam, there you go, out the door. It's I'm involved in their lives in the sense of being able to respond to their homeostasis. If not, then why am I doing what I'm doing? I have to be able to be responsive in a not in a stalking way, but in a positive way to be able to be supportive. Um, are you drinking coffee afternoon? Well, yeah, as I put my coffee cup down underneath so nobody can see it. Um, but
Guilty.
that's one of the factors. Um, do you spend a couple minutes in the morning? In the book, I talk about one of the emergency reset protocols, spending 10 minutes getting morning light, because that photon receptor, that stimulus, ready for the big word, photobiomodulation, that is essential in starting that rhythm, starting that cortisol response in a balanced way. Um, Going to bed at night, doing what we call 4-7-8 breathing. Dr. Andrew Weil, the beard, um, wrote that, what, 20 years, or I can't even remember. I referenced in my book uh,
Yeah.
his breathing technique, but that 4-7-8 breathing at night. My wife, it's hard to be a hero in your own backyard. My wife finally um, set her phone aside one night when she wasn't going to sleep. I said, "You got to go to sleep. I need sleep. Try this." And she set her phone aside and she did 4-7-8, and it wasn't 2 or 3 minutes. I shouldn't say that she snores, right? But
Not if you want to go home tonight.
well, hopefully she's not listening.
So for those that aren't familiar, tell us a little bit the 4-7-8 breathing. What's the big thing there?
Well, the 4-7-8 breathing is a technique of breathing in for a count of 4, holding for a count of 7, breathing out for a count of 8, because it's that exhale that stimulates the parasympathetic. So breathing in for, it doesn't mean 4 seconds, 7 seconds, 8 seconds. It's just a rhythmic breathing in for 4, holding for a count of 7, and exhaling for a count of 8. And if you're doing it right, by the time you hit that 7-8 exhale, it's kind of a trying to get that last breath out. But that 4-7-8 changes the diaphragm, stimulates the parasympathetic nervous response quickly, and allows somebody to relax immediately.
That hold is actually really important because during that gap is when you start getting that little bit of hypoxia. So you instinctively take a deeper breath to get the lower sections and more of that vagal response going. So
Exactly.
yeah,
That's
no,
that
it's like it's that
physiological
all those
side.
numbers are important.
Yeah, that's that physiological side too, that at the top. But a 20-minute walk, somebody takes a 20-minute walk in the middle of the day, they're resetting their cortisol. Or a 20-minute walk immediately after eating, not only does it help digestion, but it helps that stimulus to come down in a way it should.
Okay. So we got the questionnaires, we've got the 4 different varieties to be able to help to interpret the cortisol curves we're getting back. We've got some immediate lifestyle interventions to try to deal with like the immediate rescue and things like that. So I'm, now we're getting to the part where I really enjoy, which is like the biochemistry. So we get the results back. We got our 4 different points. What are your big outliers in terms of supplements to intervene? Because I know it's got to vary somewhat, at least between the 4 major types of cortisol dysfunction. What are your big players in the supplement arena?
Well, only because I'm partial to NUMEDICA. Of course, I'm using theanine, the liquid L-theanine. Um, Almost all aspects of those 4 categories, I'm giving Corti-B-plex, which is a B complex neurological support in a positive way. I'm giving them the panathetic acid. What is that? NUMEDICA calls it Paramin B.
Yeah. which
Um,
which is all which is also used very aggressively to treat migraines. And Grabowski has talked a lot about the use of B5 particularly.
right.
So
And that B5, I think even Earl Mendel years ago, is he still alive? I mean, he wrote that book, Vitamin Bible, that I tore pages out of it back 30 years ago, learning more about it. That B5 pantothenic acid is so essential in not only helping neurological response, but bringing that hormonal balance more rapidly. Um, Cortibiplex, Paramin B, L-theanine, ashwagandha as an herb. I'm told from sources within NUMEDICA. In fact, I think that was you, that ashwagandha may be something that's on the radar very soon that would be such a supportive thing. I utilize holy basil. Holy basil is another herb that's very supportive of getting cortisol balanced and getting back down to a foundational level.
What do you feel about because magnolia bark's gotten a lot of press? What do you think about either banaba or magnolia bark?
Well, I like magnolia bark or magnolia bark. I don't know. Tell me, banaba.
Banaba, it also suppresses cortisol, slightly different.
Are you sure
Depending
you're
upon the
not just?
manufacturer, some will use one and not the other, but
Are you sure you're not just doing a banana?
I am
No,
a Muppets fan, but no, banaba. So,
no, I don't know any. To be honest, educate me. I don't know
well,
banana.
it seems to work the same way that that magnolia, but I know that I had some disruptions in uh, magnolia bark suppliers for a while, and there are a couple of other manufacturers that seem to use banaba pretty effectively. It does seem to be a little bit more expensive an option. But my concern there is that usually you use it in cases of elevated cortisol and you give like this massive dose in the evening to drop it down so they can get sleep. If you're using cortisol, because it doesn't seem to boost it, but as my concern is if you guess wrong and you're using cortisol, is it going to, if you're using Magnolia to drop cortisol levels, are you going to damage their production? Do you know if there's a side effect to that if you've been using that?
I don't know of a side effect in that. You may not get as looking at the symptomatology. They may not be coming down as rapidly as you would think that they would. I've experienced that in the past.
Okay.
And what do I do? Increase theanine.
Well, but that may also go back to repeating the adrenal questionnaire you got because it seems like how often do you if you're using that questionnaire because I'm assuming you're not running a 4-point cortisol curve every 6 weeks.
Right.
How often do you run those questionnaires, for example, to get the fill in between your lab data?
Well, I like to do it at least within 30 days, but that's what we 30, 60, 90, looking at the book. We
Okay.
see, I want to know within 30 days. Usually, I had a guy come in last week and he came in and he said, Dr. Larry, I got a bone to pick with you. I said, what? He said, your book is not right. Excuse me. Um, it's not right. I said, Jim, you told me 3 or 4 days ago you bought the book. So in 3 or 4 days you've read the book and you're telling me it's not right. He said, you say 30 days. It took me 3 days. I'm sleeping like I've never slept in years. All because he jumped on and did the emergency reset protocol and it immediately started working for him. So we something like that, I can tell he's going to be more responsive. I would expect to see more changes in that 30-day period than I would a normal, or I should say a, a parameter response that I would say would be within normal issue. But I, I don't think they're going to feel the subtle changes before 30 days, but 30 days is going to give a progressive marker to allow us to know then whether we need to change, alter, or increase any supplementation.
Okay, so this isn't like a weekly thing. We probably want to look over the course of a couple of weeks to make sure we get like an established new baseline. By
No.
the way, I already got somebody who's asking is how do they get an autographed copy of the book? So you can't
I'm at 5460 South Garnett Road,
you
Tulsa,
can't
Oklahoma.
you can't have mine, okay? Sorry, but they need to contact you directly or
If they contact NUMEDICA and buy the book from NUMEDICA and give them the information, I'll sign it before they send it to them. How's that?
fair enough. Okay, so go and ask your local rep or have them phone into main office. We'll get it arranged for you. Cool. Okay, so we've got lifestyle interventions, and I'm assuming it goes without saying that the intervention of the lifestyle changes need to go along because you'll get far better out of the supplements. It's kind of like getting somebody's blood sugar under control and trying to, go ahead and eat anything you want, but take the French lilac. It's like, you've got to be doing the lifestyle as well. And you know, it is kind of weird because we're so hesitant to talk about removing the stressors from the life, and yet I'll be the first person to turn around and yank gluten away from somebody. It's
Right.
like I'm happy to restrict their diet, but I can't tell them to put their phone down, which seems this weird disconnect about,
Well,
about
and
what
we're
I'm willing
looking
to
at their
do.
inflammatory markers. We're going, look at your inflammatory markers, but hello, I mean, what's causing that inflammation?
So,
We have to take into
um,
consideration.
Dr. Berkovich has a great question. She goes, I have a client in perimenopause who has a flat cortisol curve. Okay. Says she has a flat CAR, low free T3, nominal TSH, mildly high insulin, so 7-ish. Okay. Normal A1C at a 5.4. She's struggling from weight gain, low energy, hormonal fluctuations. Question is, would you address adrenal insufficiency first with adaptogens and glandulars? Her main issue is the inability to lose weight. So the weight gain is a big part of that. So how would you approach that client?
Well, probably perimenopause. Um, Now I'm going to show my ignorance because I can't remember the name of the NUMEDICA product that Jim sponsored.
So premenopause, it's going to be the Nufemina, and that's the
Yeah,
calcium D-glucarate, indole 3-carbinol calcium D-glucarate mix.
new feminine.
Postmenopausal is the Minomedica that's got like the black co-wash and some of the other stuff added to it. So
I would utilize that formula in addition to B5 pantothenic acid, in addition to um, uh, the depending on how they did on that menopausal formula, I probably would add functional female to help balance that out and support it more rapidly. Um, if if Numedica had holy basil or ashwagandha formula, I would be putting them on that. But I'll probably
working on it.
send
I'm working on it. Give me working on it.
I probably would send them to the health food store to get an ashwagandha because it's such an excellent adaptogen.
Yeah.
And lastly, depending on how well they were responding, I would possibly even consider dual tox, phase one and phase two liver support, because that's going to help not only that sugar imbalance, even though the hemoglobin A1C is at 5.4, I'm still hearing that there's inflammatory markers and that imbalance of the sugar response that's probably part of the factor to that thyroid.
So that she does bring up, Dr. Bergovich brings up an interesting point. So um, when you're dealing with that like adrenal insufficiency, what are your thoughts? Because you talked a lot about ashwagandha and B5 and all the adaptogenic approach, holy basil, the adaptogenic approaches. What are your thoughts on glandulars? Because I'm a big fan of using the Adrenomed GL50 with that little boost of the glandular behind it. Do you think that's appropriate in all cases, or are you hesitant to put that on in certain others? Is there certain types where that's more effective than not?
I'm hesitant and I'll choose between GL50 or Adrenomed, all depending, am I trying to just support or is that support going to be more because of a deficiency that glandulars is going to bring that quicker? Generally speaking, I'm leaning towards GL50 more than just the Adrenomed.
Now I'll have to back you on that. And I've generally found that both the glandular formulas and the adaptogenic formulas, when you combine them, because you mentioned the functional female formula, rebalancing the distribution in that steroidogenic space. So, because often women go when they get more stressed, they'll push more estrogen dominant. As the
Okay.
body ironically tries to generate more testosterone in women's responses, so you can manage to redistribute that, but you blunt that cortisol curve if you're giving those adrenal adaptogens at the same time. So you have to, while you're doing the hormone stuff, you got to deal with the adrenals. Otherwise, it all kind of goes back and wants to shovel to cortisol.
Touche.
If you're giving progesterone, by the way, I found the same thing. If you're giving an exogenous progesterone, if you're not doing anything to support the adrenals, they'll just throw it straight to progesterone.
Right.
And I liked your idea about using the new femina to kind of clear out the extra estrogens because Dr. Berkovich, particularly with women that are having problems losing weight, if they've got this trap between adrenal dysregulation over here and an estrogen dominance over there, if you start detoxing those estrogens, they'll drop them out of estrogen dominance, and the adrenals can rebalance the way they're supposed to. Um, By the way, I will mention, if anybody hasn't played with it before, that new Femina that Dr. Meyer came up with that we use. If you haven't used it before, the interesting side note, and I warned my last patient today about this, um, estrogens have a particular color to them. They're a little pinkish. So when you add them to yellow urine, it'll turn to this really interesting mango color. So make sure you warn your patients that if all of a sudden it's Joseph and the Amazing Technicolor Urinalysis, there's a reason for that. So don't. I'm really good about making people's pee turn different colors. So, bright yellow and oranges and pinks and blues occasionally. So don't leave that out. All right. I hope that answers that question. Um, so let's go back to the big one that a lot of people. So the two big reasons, but we kind of wrap up, the two big reasons people start looking at adrenals first and foremost are fatigue and energy and weight loss. So what's your big take home for either of those two categories, and how do you kind of address those in the book?
Well, when I'm talking about energy, is it because their energy is being spent inadvertently in a driving factor, or is it because they're just not getting the nourishment to be able to have the function they should? I'm looking in their blood work at their protein, for example. Looking in and trying to determine their mitochondrial function. Am I supportive of that mitochondria, or is it the ATP that I'm missing because the mitochondria is not up to snuff? So I'm probably going to lean to something like MitoSpark. I used mitochondrial recharge for the longest time until NUMEDICA came out with MitoSpark, and it's like I can't keep it on the shelf. It's far beyond. Now they've even got one step farther, but the MitoSpark being a support for energy in ways that are positive and function. For the fatigue factor, I'm looking at that Corti Bplex, because if they're if they're 3 o'clock in the afternoon, um, having a nap feeling, then MitoSpark I know is going to help. But if it's that morning can't get balanced and functioning, I know it's more neurological. I'm going to support that with Corti Bplex. So it just kind of depends on what functionality I'm trying to address.
So I'm gonna ask the chicken and the egg question, because this is where I get into big arguments, particularly with like Bill Kleber. So do you think it's the adrenal failure that drives down the thyroid, or do you think it's the thyroid dysfunction that drives forward the adrenal failure? Because the two of those work in concert.
I think it's a hypothalamic imbalance. So
Ooh.
I'm going to stand in
Dodge
the
the
middle of
question and hit the middle ground. Thank you, Lynn.
it.
Fair enough. Fair enough. Okay, weight loss. What's our big take home for weight loss? And assume their energy's fine, but they've still got the Dunlop going on. What's our knee-jerk response to start for adrenal dysfunction and cortisol dysregulation for weight loss patients?
I start them off on a 14-day detox, and the 14-day detox helps quicker than anything that I know of, not only to get their sugar where it should be, or at least in the right direction, as well as getting that liver function working and giving them the nourishment that their body needs. I have people do 14-day detox and they go, wow, I dropped 8 pounds. Well, I'm not giving it to them for that purpose. I'm giving it to them to be supportive of their system. But they tell me that's why I started off years ago with that 14-day detox, because I'm wanting to rebalance, but the side effect is good weight loss. So I'm starting
Well,
off with that.
and you're standing among giants in that regard. I mean, I've had that conversation um, with Dr. Kessinger. I've had that conversation with Lane Sebring out in Wimberley, and both of them do the same thing. It's like you come in, and the first thing you do before anything else, they draw your blood. You do a month long liver cleanse and detox, and then they get the results back, and the rest of it's just easy. So you're among good company there. I'm not going to be quite as militant about it as Sebring, who basically makes everybody just go out into the forest and wear a loincloth and go paleo. But that seems to be a fairly consistent mode, is that you kind of get into this detox, reset the adrenals, and it makes that process there from there go a little bit easier. Okay,
Right.
so the book covers the big questionnaires. The book will go into the emergency reset protocols and some of the lifestyle, and we covered those, a lot of those vagal resets and breathings and first light in the morning and don't run with scissors, don't swim after eating, that sort of thing. So all of these quick, lifestyle interventions to get bigger gains faster, apparently 3 days. So docs, if you're listening to this and you get into it and you get somebody who can do it in a couple of hours and beat out Larry's 3 days. Okay, the goal has been set. Just let us know. You go into the various types of dysregulation, so we know how to interpret the results that are coming back off of um, the the hormone curve. Um, we got a basic idea of what supplements are going to work. I know that you've talked a lot about some of the other interventions, including lifestyle support and community involvement and things like that. Is there anything we haven't talked about that's in the book that you think is essential that doctors that are focusing on cortisol dysregulation need to be aware of, either lifestyle or supplement or mindset, diet, something we haven't talked about that's essential to understand of how you're going to manage that dysregulation in the adrenals?
How deep down the rabbit hole you want to go? The
I
key
don't know, how
being
many hours do you want to be here?
the key being all
I
of those.
heard the 4 hour version of this, so I'm good, Larry. Let's go.
Well, the whole key is the synergistic ability of the integration of those. I'll never forget Dr. Bernie Siegel years ago wrote the book Love, Medicine, and Miracles. And he wrote that book as a support to cancer patients. And he started what's called the Exceptional Cancer Patient Society and that whole visual imagery aspect. When we think about the synergy, are we going to get the better response, getting the body to integrate together from body, mind, and spirit? Yes. So we've got to consider the stinking thinking. We've got to consider the what people say, oh, I drink lots of water. Really? Well, how much passes your lips? And you'll see them just kind of stop in their tracks because they just assume they drink lots and how important that is. So we look at the whole body. We look at the whole body, mind, and spirit aspect. When we delve into the aspects that B.J. Palmer came up with, I talk about this all the time. He said thoughts, traumas, and toxins. Well, thoughts, traumas, and toxins creating the imbalance that we as chiropractors try to correct. If all I'm doing is adjusting, and I'm opening Pandora's box because then I'm going to exit stage left. If all we're doing is adjusting and we're not addressing these other issues, are we addressing toxins? Are we addressing thoughts? No, we're just addressing the trauma. So we have to address the stinking thinking. We have to address what they're getting toxicity wise or not getting in the case of hydration, etc. So it's a balance, thoughts, traumas, and toxins, as BJ spoke about.
There you go. By the way, you bring that up. One of the other things that I really like as you get later on in the book, one of your chapters, like toward the end, you actually have 7 major case studies that all kind of exemplify those that are more trauma and toxins and so on and so forth. You got 7 of those. So it's not just you've got a very practical model to be able to take those and how you implemented that in various case studies. And I went through them and it's like, yeah, you pretty much covered the gambit of what you usually see in adrenal dysfunction. So anyway, no, I think it's great. I suggest that anybody that's interested in it. Now we offer this. You should be able to, if you contact your rep, I know we get copies of the book and your protocols that are available through NUMEDICA. Apparently you've offered anybody who wants an autographed copy that she'll go down and do that. So you know, we've heard that, poor Raylene. So we'll make that happen. Otherwise, where else can they get a hold of a copy of the book?
Amazon. Dun 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 dun.
Yes, that's right, because Bezos needs more of your money. Um, keep it local, order through your rep. Okay. Anything else in closing? Docs, if you got any other questions, I know that I've tried to weave in a lot of the questions off to the side into stuff that I've interjected. So if it looks like I'm just coming up on this on my own, I appreciate you guys being here, by the way. There is the interaction I get by you guys asking questions. I know it's not an open roundtable, but that's how we all learn, is more of a case study approach. And if anybody's got any other questions, pop them in real quick because I try to get all of them answered. But Larry, I want to thank you so much for your time this evening and you gifting us with your experience with this dysregulation. A lot of people are just kind of taken it as granted that it's all, just give them ginseng and it'll all go away. But there's a lot more complexity to this. And it sounds like if you don't get it fixed, a lot more of your problems are going to be harder to get under control. So I appreciate your multimodal approach toward this. You got any final thoughts before we draw the grand rounds to a close this evening?
You've covered all bases that I could even consider. I believe that if we truly take our patients in consideration in all aspects, not only are we doing better, they're doing better, but the word then becomes more just like yesterday or day before yesterday, one of my patients called and said, "Do you have any books?" I don't keep books here to sell per se, but her sister was in town visiting, and she had such a response. She said, "I don't want to give my sister my book, but she needs to know this." It's just one becoming the other, one supporting the other, and that's the relationship we have with our patients through love.
Well, we need to support our patients, but I'm glad you're here for us as a community of providers to be able to exchange this information. And thank you so much for supporting us.
Thanks for
So,
being here.
doctors, thanks for being here this evening. It was always, as always, a pleasure. We thank those of you that have managed to make it here and reach out to those people that missed it. We're going to have this available via recording. And if you're interested in getting a copy of the book and deeper copies of the treatment protocols and the questionnaires, etc., it's all in the book. Well worth the read and supporting members of our community. Thanks, Doc, so much, and we will see you next month. Watch your emails for the upcoming series. We do have stuff planned out through the fall and a lot of really cool stuff coming up. Otherwise, we will see you next month on a random Thursday.
Excellent.
Thanks,
Have a good
guys.
night, Victor.
Night, Larry.
Good night.